Hey everybody, this is Robert from Merritt Web, and excited to begin the process of redoing or expanding the video base here for QuikTest results in anticipation of the exam that's going to be created for this set of results. And we'll talk about that in just a minute. But this particular video, it's the first one in the series, is going to be more of a philosophical discussion about QuikTest, what it's for. This is essential material. Some of this is going to be on the exam. I would encourage you to listen to this entire video presentation because it is important. First of all, when do you use QuikTest? When is the right time to use it? And the answer to that is, number one, you use it every time that you get a new client. Routinely, QuikTest should be included in the set of results or in the package of assessments that you choose to give to a person. Don't exclude it. Don't assume that there are no issues. This is a barometer of who this person is and what kind of crisis level they're experiencing. They can be in crisis and not tell you about that crisis. Some people are really good at hiding it. This test usually brings it out. So always use QuikTest every time you get a new client. Every time that you haven't seen a client in 2-3 months, use it again as if the client was new. The next question is, when do you not use QuikTest? Well, I would say that you should, if a person has an elevated score, anxiety, depression, personal safety, if they have an elevated score above 115 on any of those scales, you should retest them the next time you see them. Don't skip it. That person has some amount of crisis. If they're 120 or 125, you've got a real crisis on your hands, and it's almost irresponsible for you not to re-administer the next time you see them. It may go higher. It may go in 130s. Now you've got a raging fire. QuikTest is free to use. There is no per-use charge for any of our assessments. You should be using it every time a person has an elevated score. For the next time that you see them, I would continue to administer QuikTest every time you see them for 4 times after it goes below 115. Once they normalize, continue to look at their scores and make sure that they stay under the crisis levels. And that information, or that particular thing, is on the exam. I personally believe that it's irresponsible not to administer a tool that can show you if a client is in dire crisis. And connected with that issue of irresponsibility is the concept of documentation. When a person's scores are elevated, you better be recording and documenting in session notes those elevations and exactly what you did about it. If you have an unfortunate episode where a client attempts suicide or is successful in suicide, there's a likelihood that the family members will attempt to sue you. If you have no documentation, you will lose. There is no question. You will lose, and your insurance is going to be hit, or you may be hit personally. You need documentation that at least states that you recognize the elevation and what you did about that. I have simply included a line. A client and I discussed elevated personal safety scores, and client assured me that they had no desire to harm themselves. That covers you. That says we talked about it. I recognized it was there. We talked about it, and the client said they're okay. The client does something wrong. Well, I can't control whether or not they lie to me. So document what happens or what you do with a score when it's elevated. You have to do it. It has to be documented somewhere. Cover yourself. How long are the results valid? You'll notice here, this is real client material, John Doe. Obviously, it's masked. There are 129 sets of results in this report. So this person's taken the test for me over years as a test case, but these are real results, 129 times. Okay, I have selected to view the results from 1 to 2017, and that happens to be today. Okay, the selected QuikTest results are current and can be considered reliable. Verify results by interview. This says that since these results are so current, they can be considered as reliable results. Now, if it was 3 or 4 or 5 days, it's going to say that things have changed. Things may have changed, and you should probably re-administer. QuikTest scores can change very rapidly. We will be looking at a new graph that I have, and there are a number of new graphs in here, but one that you will be able to see radical changes in this particular report, and maybe you will understand why you need to have current QuikTest results, not QuikTest results that are old. I consider 3 or 4 or 5 days with a person who is in crisis old results. And we'll see why in a little bit when we get to the graphics section. You will be able to see a graph that shows results from 10 previous administrations. You'll see how wildly things can change with a person who's not even in crisis. So if you are using results from a month ago, that is irresponsible, it's unethical, it's wrong. It is wrong to do that to a client. Say they were elevated at 120 and you open it up and you say, you know, your anxiety is at 120. No, it's not. Their anxiety was at 120 2 months ago. Where is it today? Has it dropped or is it worse? Again, it's free to use QuikTest. It's called QuikTest because it takes 5, 6, 7 minutes for a person to take it. It's a quick test. It's been on the market since 1988. This thing has been administered thousands of times. And it's considered extremely reliable in what it shows. It was over a year in development. So make sure that your QuikTest results are up to date. If they're not, have the client take it right there. Take 5 minutes out of a session to see where that client is. There are 2 phases in counseling, and that's what we're looking at here with QuikTest. There's 2 phases in counseling. One is the crisis phase, and number 2 is the reconstruction phase. Now, unfortunately, some people only do crisis counseling. When the crisis is over, they think that the counseling is finished because the fire was put out. And that's absolutely untrue. Once the crisis is over and has been averted, and the scores are below 115 here, now we can begin reconstructing. We can look at the PSA scores. We can look at anger scores. We can look at home of origin scores, addiction scores. And we can say, okay, now we're looking at the real person here without the crisis, without the fire. What needs to be fixed? What needs to be reconstructed? In the face of the fact here that scores are now normalized and you're not looking at a fire anymore. So continue to administer QuikTest until the fire is out. After the fire is out, now you need to have an investigation to find out what caused the fire. Lastly, I have decided that since this test is so critical, and since there are some things that a person can do that would not be fair to a client, that we need to have an exam for this. The exam is going to be free, and the exam is already done. It's 28 multiple choice questions, a couple of true and false in there. But it's stuff that you need to know about this so that you can fairly interpret these results and relay that information to a client and deal effectively with a client. What's a crisis and what's not a crisis, and you need to know and understand how to deal with that. So you will be able to use QuikTest 10 times once I get it all done and set up here without taking the test. However, you'll get a warning every time you try to use it that says that you've got X number of administrations left before it's shut off. It will only be shut off until the time that you take the exam and pass the exam with 70%. I really believe that it's fair to do this because of the fact that this is being used to make judgments on clients, and if you're using this thing with 2 or 3 or 4 month old results and realistically attempting to look at a client through those results, that's not fair to the client. It's unethical, it's unreasonable, and you need to understand the difference between anxiety and depression if you're going to be using this tool. I would encourage you to use this tool more and more. At the top of the report here where it says therapist specialty, there's going to be another line underneath this that says therapist certification, and that will obviously be something that the client will see if you show them the report, and it will say adequate knowledge, average knowledge, above average knowledge, or superior knowledge based on your score of the test, so that the client can also be appraised of how well you understand the results for this test. So this is video number 1 for the exam, and the next one we'll discuss some other stuff related to the actual test results themselves. So for now, that's all we've got.